just been exposed to so many different opportunities.
I've really come to love the diversity of the campus.
The experience here has completely changed my life and made me realize that I can fulfill my dream.
Kent State University is poised to celebrate 100 years of teaching and research excellence next year. As the largest producer of associate, bachelor's, master's, and doctorate degrees in Northeast Ohio, Kent State maintains the third largest enrollment in the university system of Ohio and one of the largest regional university systems in the country. Ashtabula, East Liverpool, Geauga, Salem, Stark, Trumbull, and Tuscarawas. Ranked among the nation's top 77 public research universities and among the 76 top colleges and top universities in community engagement by the Carnegie Foundation, Kent State offers learning opportunities in 281 academic programs.
None of my family's ever been to college before, so I'll be the first one going to college. I'm the first generation, and I feel like it's very important that I make it and succeed.
I have great professors who work with you 24/7.
There's a lot of different majors to pick from. There's a lot of different classes that you can take.
It's been a really great, just growing time for me in my life.
I haven't had a professor that I haven't liked, and it's really nice. I'm really glad I came here.
Over the years, Kent State has moved beyond its campus borders to become an engine for economic, cultural, and workforce development in the region, and earned acclaim for applying new knowledge to address the needs of the communities it serves. And Kent State is embarking on a bold new venture. Best and brightest students from across the country, nationally recognized research expertise in the sciences, and the ability to address the urgent career demands of the future, all coming together to create Kent State University's new College of Public Health. Kent State has turned its attention to the nation's worsening healthcare crisis and the impact on our communities. By the year 2020, America will reportedly need 250,000 more public health workers, a well-educated, technologically savvy, and multidisciplinary workforce to protect us where we live, work, and play.
There are programs in public health, which are what most people actually think of when you say public health. A program just means that you have the capacity to deliver a Master's of Public Health education. College of Public Health is a much bigger step. It means that you have a coordinated, integrated program of public health offerings. It means that you have an independent college, that the faculty there have met the qualifications to be part of a public health endeavor, that you have at least 2 levels of education, the Master's of Public Health and the Doctorate of Public Health or doctorates in public health. Our program goes one step farther. We're going to offer a bachelor's degree in public health as well, a new and pretty exciting development across the public health world.
There is only one College of Public Health in the state of Ohio at The Ohio State University in Columbus, Ohio. Most of the major states, large states like Florida, New York, Texas, and others, they have more than one school of public health.
I don't think people do realize that public health touches everybody every day in some way, whether it's in the air that we breathe, the water that we drink, or the way that we handle the waste that we throw away. Public health touches us every day in every aspect of our life.
One of the biggest concerns we have right now is the loss of public health employees. A large number of public health employees are right at the cusp of retirement. In fact, the U.S. Department of Labor has predicted that in the next 5 years we're going to lose 50% of the public health workforce due to retirements.
If we don't increase our public health resources, then our lifestyle in our society, our way of life in America is probably going to change substantially.
If you look at the statistics, they're talking about the generation now of children may actually have a lower age of death than their parents do because of things like overweight and obesity and chronic diseases that are completely preventable.
For us to have an organization that's stepping forward like Kent State, and our hope is that would be collaborative with other organizations in the region to create a true school of public health in this state. As you know, Ohio, there's only one other organization that has done this. So we think it's absolutely critical.
I think at this point we need to take the lead, and we need in the northern part of the state here to have a school of public health. I think it can enhance the other programs that we have in some of the colleges around here, but I think we need a beacon in the Northeast.
National studies have shown that about 20% of people who work in public health don't have formal training in public health. So the first major impact of a School of Public Health is that we are able to provide formal training at the regional level.
I think public health is right smack in the middle of what we have going on right now. And I think the decision to move forward vigorously with a public health model to utilize the expertise that we have here at the university, working aggressively with our community partners, is the right way to go.
I feel that public health is very important, especially nutrition, because it's good to educate people as preventative care. Before, we have all these illnesses as diabetes and obesity. It's great to just get out there and have education.
I was surprised to know that so many people didn't know what to do when they got a cold or a fever. They just didn't know what the difference between a flu and a cold was.
I see stuff that I learned from class all the time going on in the community that I'm like, I learned about that, and you probably shouldn't be doing that,
We surveyed students on campus to interview them about their hand washing techniques, and we found that many students don't know the proper techniques, and many of the bacteria is therefore transferred to the public computers.
Careers in public health are vital because really public health jobs are what keep us safe.
We can prepare our students to go out into the workplace, into the world, as a student of public health with a solid public health training and degree, then Kent State has really made a major impact on public health.
I think the timing is right. I think it's an area where we can commit some of our resources in a proactive, forward-looking way.
Not only in Northeast Ohio do we have public health challenges, but I think this is something our whole country is starting to face.
It's the right time. It's the right school at the right time in the right place.
Kent State sits at an important juncture in its future and history, if you will. The moment we're at is as universities face new challenges that are economic in nature, as the state of Ohio thinks about the role of higher education, universities need to say, what can we provide that's unique? Public health is one thing Kent State can provide.
Kent State University. That's excellence in action.